heart is the most vital organ in the human body. It continually pumps blood throughout the body to provide the essential oxygen and nutrients our cells need. At the Miller School of Medicine, our researchers are pursuing scientific breakthroughs in the mysteries of this incredible organ. These discoveries are leading to life-saving innovations in the treatment of heart-related diseases and disorders, and it all begins here in our laboratories. Heart arrhythmias are very common, and nearly everyone will experience an abnormal heart rhythm sometime during their lives. For many people, atrial fibrillation, or AFib, is common and often undetected, leading to heart disease and stroke. This is where researchers like Dr. Jeffrey Goldberger are exploring revolutionary methods like 4D imaging to better treat patients with atrial fibrillation.
I've had a long-standing interest in problem solving. As I developed, I wanted to apply that strong interest in solving challenging problems into something that's very meaningful and has significant impact. Atrial fibrillation is a complex heart rhythm disorder. Electrical activation in the upper chambers becomes completely disorganized, and instead of beating at a rate of 60 beats per minute, it can actually start beating at 400 or 500 beats per minute. It can really produce a whole array of symptoms and problems for the patient. By putting tubes into the blood vessels in the leg, and then we put wires up through those tubes into the heart, we can actually map the electrical activity of the heart. So we can find what looks like normal activation, and we can also find what looks like abnormal activation. There's a lot of very supportive evidence to suggest that this is going to be a brand new approach. In order for us to really impact the problems, we have to think about new approaches, changing the paradigm of how we're doing things. The truth is, without philanthropy, we would never be able to accomplish what we have so far. The opportunities for patients to actually access tomorrow's state-of-the-art care is something that I think we're really proud of here at the University of Miami.
The advances in our laboratories are also leading to groundbreaking treatments in vascular surgery. Doctors Omaida Velazquez and Roberto Vasquez Padron are researching the ability to regrow vascular tissue to avoid devastating results for patients with advanced arterial plaque buildup.
This disease is the universal killer of the world. It is the most common disease, and it happens in every human being as they age. The research that we're working on is aimed at preventing amputations. This is my great passion for decades now. When I see my patients and everything that modern medicine is there, including my skills as a surgeon, and still they're not feeling better, and God forbid they still are looking at an impending lower limb amputation, it's devastating to me at a personal level. I don't want that ever to happen. And so my path, my career has been preventing that. Learning how to make new blood vessels to overcome those blockages has been the holy grail of vascular research for many, many years. We have discovered the type of signaling molecules that the cells use when they meet each other to talk to cell. That is an incredible breakthrough. No matter how close we think we are, we know we have at least 5 more years. We will need a lot of resources and investments so that we can get to a cure. Our dream is that we'll never see anyone ever needing an amputation again.
The kidneys are very related to vascular diseases. When your kidney doesn't work well, your body has too much toxin, has too much water that damage the blood vessels. Now, the only solution we have is a surgical procedure. What we have discovered in the lab is that some drugs that are used for other purposes can be used to prevent the blockage of the vessels in the patients with kidney diseases. This is going to be a great discovery. It is very important for us to take all what we discover here in the lab to a cure for a disease. This is my passion for life. Since I'm a kid, I want to be a scientist. I want to have a solution for people in need.
Our researchers are also moving quickly to understand the long-term cardiac complications of COVID-19. Dr. Carlos Alfonso is looking for ways to help survivors rebound from cardiac abnormalities that arise from the virus.
The heart is the motor, so to speak. From a mechanical sense, it made sense to me. The physics of it made sense. Over the past 10 months, we've really had to quickly pivot and change some focus of research based on what the necessities of our community and really the world has become. Many of my grandfather's brothers were involved in medicine back in Cuba. I always heard the stories about the good old country doctor, surgeon whose family came to them with no means, but nonetheless they did the surgery and helped the patient. And so that kind of family legacy, so to speak, always spoke to me. Normally coronaviruses haven't been known to affect the heart so dramatically as this virus has been shown to. What we've seen now is that there are some patients that may have been perfectly fine during their infection, but it's 2 or 3 or 4 months after the fact that they may start to develop some symptoms that are concerning for cardiovascular disease. One patient population of particular concern is athletes because of the increased stress on the heart. My colleagues here at the university within the Division of Cardiology, in conjunction with the Sports Medicine Division, have developed a program for evaluating athletes not only in professional sports, but in those that are participating in high-grade athletic activities to see if it's safe to resume athletic participation. It's a novel program. There's only a few programs in the United States that are looking at this. I think we still have a lot of research to do. What we hope to be is better positioned to eliminate or at least minimize the long-term effects that the virus may have on the heart.
The human heart is miraculous and powerful, but so is our commitment to finding novel and effective treatments for cardiovascular disorders. We are continually pursuing cutting-edge ideas that will improve the health of humanity and the quality of life for so many of us. We look forward to partnering with you to continue developing this revolutionary and life-changing medical technology.